All right, so let's get serious for a moment. You don't know me, clearly I don't know you. And so the big question is, why in blazes should you waste your time or invest your time in looking at these videos, listening to somebody you don't know? And I think that it's appropriate for me to give you a background as to who I am, where I came from, what my education is, and how I got to where I am today. So we all know my name is Carlos Garcia. I went to the University of Massachusetts Medical School. I then went to Hahnemann University and trained as an anesthesiologist. I moved to the Tampa Bay area and I had a very successful career as an anesthesiologist. And then I injured my right hand. That terminated my anesthesia career. I was really lost, like many people who had become unemployed. I felt all the same sensations that people do when they have a loss, because as many of you, I have identified myself with what I did, not necessarily who I was, or a better way of saying it is I had confused who I am with what I did. And many of us define ourselves by the career that we've chosen, not by the person that we are. And I was no wiser, no dumber than anyone else. If you get nothing else out of these videos, I want you to understand that physicians or doctors are no brighter, no dumber than you. And we all have the same emotions and the same feelings. So when I was at a loss, I had to find myself, and one of my friends said to me, hey, go babysit this thing called chelation clinic. And I said, well, what's chelation? He goes, well, I don't know what it is, but whatever it is, just go do it. Get a purpose in your life again. Do something. Don't just kind of go with the flow and be like a cork bottle in the middle of the ocean. And so I did. And for the first week or so, I had no clue what I was doing. I mean, I was practicing medicine, taking people's blood pressures and talking with them and evaluating them. And that was pretty much in the box. But then I noticed that people's blood pressures began to drop. And I started reading about what this EDTA, which stands for ethylene diamine tetracetic acid, which for the purposes of this taping, we will call EDTA. So therefore, the EDTA was actually helping the body heal. And people's blood pressures were dropping. And people who had type 2 diabetes, their blood sugars were getting lower. And I said, holy smokes, I'm in the middle of what they call alternative medicine. And so I started reading about vitamin C, and I started reading about intravenous hydrogen peroxide and all these crazy things that I knew weren't going to work. And I knew they weren't going to work because I was told in my traditional medical school training that basically real medicine is taught in medical schools. And if it's not taught in medical schools, it's because it's bogus. And I believe my teachers because we're all programmed to believe authority, and I was no better. I knew that my teachers knew everything. I knew that my teachers had my best interests at heart. I knew that my teachers were guiding me in the correct way of becoming a successful physician, which I became. And I knew that if I had not been exposed to it, that it was probably a little bit on the shady side. Because after all, the dogma is, if it's that good, everyone's doing it. But they weren't. So I said, here's what I'm gonna do. I'm going to take a piece of paper and I'm going to write down all these incidents, and then I'm going to go to Hollywood and I'm going to make a sitcom, and I'm going to retire. So I started taking a notebook and I started keeping notes, and all of a sudden patients got better and better. And I remember one Wednesday afternoon, a patient came to me and showed me their blood pressure chart. And the blood pressure chart had shown a progressive decrease in their blood pressure. And so I did the natural thing. Well, you're over-medicated, so let's cut down the medication. And then the following Thursday, I took a 2-hour shower because I was really, really perplexed by what I had just done. Medical model, the dogma, is that you're put on drugs. The drugs eventually need to be increased in dosage, or the drugs are refractory, that is, they don't work for you anymore, and they need to be replaced. But the idea that your body could actually heal and not use the drugs long term was clearly not one of the mantras taught in medical school, with the exception of antibiotics. Antibiotics are the only set of drugs that are used for a time-limited fashion and then usually discarded. So At that particular moment, I realized that the dogma of I've been exposed to real medicine, I've been exposed to all that one needs to be exposed, was not true. I felt betrayed. It was not until I read an interview back in the 1800s with one Nikola Tesla, probably the smartest man ever to walk the earth in my opinion, that I realized what education is all about. Nikola Tesla invented the monofilament that was used in the incandescent light bulb at the turn of the century. When Nikola was interviewed by the newspapers, they asked him why he had picked tungsten. And he said, the reason I picked tungsten was because I didn't go to school. And I said, what? That's an odd answer for a bright man to say. And he went on to say, had I gone to the university, I would never have chosen it because the professors already know that it wasn't going to work. So I wasn't going to waste my time because the professors would have told me not to waste my time. And at that moment, I basically saw my entire educational career flash in front of me. And it made perfectly good sense how all my teachers had taught me, don't question, don't ask, follow instructions. Others smarter, brighter, other people have done all this research. There's no sense in questioning what's written down because what's written down is the gospel truth. And at that particular point, I was still so brainwashed that I actually looked for an alternative medical residency program, only to find out to my benefit, although I thought at the time my detriment, that it was not available. So I went on to have to learn and teach myself as much as I could from unknown practitioners worldwide. Unfortunately, at that time, the internet was in its infancy. You were lucky to have a 1200 baud modem. And my learning curve began to take form. And it was very interesting because at that particular time, I recognized the fact that the patients actually knew more than I did. So I had to be the student of those people I was caring for. And believe me, it was a very interesting time in my life. I was reading everything that I could get my hands on to try to understand the human body in a whole different perspective than the way I was taught. Afterwards, I realized that indeed the body is able to heal itself. And then I met my next conundrum, which was, well, the dogma is doctors can cure. The reality is that they cannot. So if I can't cure and I want to be a doctor or be a physician, then what's my role? Well, the role of a real physician is to empower the healing properties within every one of the people that come across my path. I'm here to educate you, I'm here to empower you, I'm here to show you where you're making bad choices for your edification, and then it's up to you to either change or not to change. But I can tell you one thing from 20 years of having done interactive medicine. If you're not happy with your state of health, then your environment is not a healthy environment for you. It may be healthy for your wife, or your children, your husband, your parents, or whomever, but it isn't healthy for you. So therefore, change is not an option if you want to change your ill-fated path. Change is a necessity if you want wellness and health again. One of the things that you learn when you do interactive medicines is we try to figure out the source of why you're sick. So we're not interested just in treating your symptoms. Yes, I use drugs to help mitigate pain. I also use technology to mitigate pain, which has less side effects in my opinion than drugs. It seems like there's a book called The PDR in Medicine. It's about, when they used to print it, it was about 3 inches or so. I would say 80% of that book was side effects of medications. Forget interactions, because really nobody has a clue about interactions. And a little factoid is about 20,000 Americans die from drug interactions on a monthly basis, and have done so since, at least from my knowledge, about 1980 on. And it's no end in sight. And it's an acceptable loss, which I think is very shameful. But back to my quest. I have been educated and I have played in traditional medical models. I was an anesthesiologist, which is about as right-wing as you're going to get because it's purely pharmacology. It's all pharmacologic. So anesthesia, being a pharmacology, gets me as in the box as I believe humanly possible. Now I've gone to the other extreme early on where I tried doing everything naturally, and then I equilibrated by being able to take the best of traditional medicine, oriental medicine, what they call alternative medicine, and I've combined it to make it interactive medicine. Because the key feature in interactive medicine is an interaction between you, the patient, or as we call them here at Utopia, the campers, and we, not just me, but we, the staff, who are talented in many different ways, where I don't have to be the sprocket that makes everything happen. I'm one of the many sprockets, and some patients heal because other patients talk with them. Some people heal because they deal with some of the staff, and some people heal because of what I tell them. It's not about who tells it, it's about you, the camper, getting better. You, the camper, finding your wellness. You, the camper, feeling at ease and being happier, because happy people don't get sick. So just take a look around my office and just document what I call the wallpaper. I have a whole wall where all the diplomas are neatly put up there so that you can see all the wallpaper. And I call it wallpaper because the diplomas don't make you a good healer. Healing comes from a different perspective, and in order for anyone to be a good healer, you have to have an interaction between the person seeking healing and the person offering guidance. And that's what a real physician does. He offers guidance, and he goes to his toolbox to use antibiotics when they're necessary, to send them to a surgeon if there's a broken bone, to do radiographic studies if we want to know what's going inside the human body, or to use supplements to promote immune system recovery, or to detoxify the body. There are many different scopes, and we've managed to implement them. And the most important aspect is you. The interaction between you and I is totally paramount for your success. That's why we do what we do. I thank you for listening. Enjoy the wallpaper, and hopefully we'll broaden your horizons. And listen, it's okay to be scared about, holy smokes, now we've got a different choice. There's interactive medicine, there's traditional medicine, and this guy tells me that I've got to sort of communicate with him and talk to him. And the model was the doctors talk to me and I don't get to say anything except yes sir or yes ma'am. That model no longer is effective. So enjoy the ride, explore your options, and remember, it is all about you. Thank you.